Hi everyone, I hope you're all well. Welcome to Educational Flu Event today. My name is Simajit. A lot of you know me as Sim, and I'm one of the Customer Success Manager here at my GP. With me today, I have members of the Customer Success team and a staff practice who will share their experience and the challenges they will face this flu season. And also in today's session, we'll be covering a couple of demos of some of our products and take all the questions at the end. And also, I just want to remind you, before we get started, we do have a prize draw as a thank you for attending this event. One lucky winner will receive a luxury afternoon tea at an Ivy restaurant of your choice. Again, details will be disclosed at the end of the session. Did you know 61% of patients were unsure of how to book a flu jab, plan to call the practice reception for any guidance? 76% of patients view SMS invitation as a preferred communication format regarding information around flu vaccinations. 95% of patients who are eligible for a flu vaccine will not book until the center takes reminder directly. And 20% of patients are not aware they are in an eligible group for vaccination. Now, this information was taken from a recent survey we conducted with 1,000 patients. I'm now going to pass it over to my colleague Amanda, who will explore this further.
Thank you, Simajit. Hi, everybody. I'm Amanda, and I'm also a Customer Success Manager here at my GP2. For today's event, we've spoken to several healthcare professionals to share their experience of managing a flu programme, together with their expectations and the challenges they envisage this year. So I'd like to share our discussion with Practice Manager Christine Bunton from the Village Green Surgery in North Tyneside with you. My name is Amanda Hayward, and I am the Customer Success Manager that looks after practices in North Tyneside CCG, where your practice is based. And I'd just like to thank you for your time today to share your insight into how you've managed the flu campaign in previous years, and also discuss with you how you think the challenges that you'll face this year and how they differ. So before we start, please can you confirm that you're happy for us to record this interview for our educational flu events and also for marketing?
Yeah, hi Amanda. Yes, thank you for having me, and I'm more than happy for this to be recorded. That's fine.
Brilliant, thank you. So Christine, do you think it's more important than ever this year for patients to be given their flu vaccines?
I do. I think it's important every year, for obvious reasons. This year in particular, because the last thing the NHS needs is a bad flu season. I think people's immunity may be lower from lack of contact. I think flu numbers were down last year, but we're all back out again now. And I think if people start getting very sick from flu while COVID's still around, it will put a lot of pressure back on the NHS. So more important than ever, yes.
Yeah, and then I suppose then that it's not just the NHS, the hospitals and things, you know, it's actually in the GP practices as well, isn't it? You know.
Yeah.
So in previous years, what challenges have you faced in inviting patients for their flu vaccines, getting them to actually come in and have them?
The main challenge is probably the phone lines going absolutely crackers, you know, but you're used to that. If we're lucky, we're a big practice, we have a few departments with a few phones, so you can manage it. Last minute coding changes, you know, you suddenly you've run a flu full campaign and then they decide that actually the code's changed, so you have to then go be back, and that's always fun. Eligibility criteria changes, so, you know, 1 minute carers are included, the next they're not, or if you work in a dentist you can have it. And then people jumping on that bandwagon, they suddenly realise that they are eligible, so can you code my record as I work here? But I think the main thing is obviously the traffic, the incoming phone traffic.
Yeah, and I suppose that'll be even more so now with limits on, you know, patients that you can have in the practice at one time with all the social distancing still that you're trying to adhere to.
It is. We did used to do it 1 minute appointments, and you know, it was you'd have like busloads drop off and people were in and out like that. But obviously now we have to factor in, if we're given the COVID booster as well, if it's Pfizer, they have to wait for 15 minutes afterwards. Where do they do that? And you know, the one-way system, so we're not having people all over the waiting room. Trying to keep as safe as possible is a huge challenge.
Yeah, I can imagine. Have you given patients the option to decline the flu vaccine? You know, when you send an invitation out to them, that they can reply back with a decline code. Is that something that you would use?
We do, yeah. We did that last year. I mean, last year was the first year that we invited using SMS and iPlay or texts. And even in the letter we say, please get in touch and let us know if you're going to decline. It's important for a number of reasons, mainly patient choice. It's absolutely up to them. But equally, again, to code the patient record as having been invited and declined for QoF targets. It's important to us financially that we have this information recorded. So more important than I think a patient realizes.
That's it. I suppose, you know, if patients have got a quick, simple option to let you know that they don't want it, if that's their choice, at least that their medical records are up to date. So that's really good.
Yeah.
The cohort of eligible patients has expanded this year to include children up to 17 years of age. Now, do you think this will present any additional challenges for the practice?
The main one, I've thought about this, and you would think just adding an extra year, you know, an extra age group, it wouldn't be so much, but the main thing is that they're school age, they're still in education. So we would have to do this in a time where they're available. So it could potentially be out of hours work for us.
Will they be having the vaccines in the practice, or do you know, or will they be done in the school setting?
I don't know.
Okay.
Sorry, I should have said if it was happening in primary care, then we obviously will have to cater for them outside of hours.
And I suppose that's the thing, nobody knows with a lot of the things with flu. That's half of the problem, isn't it? They're not knowing.
Yeah, there's a lot of unknowns at the moment, isn't there? So
yeah,
you have to kind of plan as if it's going to happen, and then if it doesn't, at least we've been prepared for it. So that's
it. Now, the flu enhanced service specification now requires you to include patient ethnicity data to be collected. How are you planning on achieving this? Is it something you've already started, or?
This is a hard one, because ideal world for us, it would be great to be able to send out a batch. You know, could you let us know your ethnic origin? But obviously there's no way, there's so many options and there's no way of getting a direct answer back easily. And so what we did last year is we used the flu campaign as the way of doing it. So when people were ringing in to book their appointments, we were asking them then if we didn't have that. And when people came in for their appointment, the admin staff were aware to check if we had it. And we just plodded through it that way, and we plan on doing the same this year. But the flu campaign is a good time to actually get that information, because you're getting a lot of people.
Yeah, I suppose there's a lot of people coming into the practice that you wouldn't usually see, and it's a good chance to get that. No, that's really good. The JVC has advised there shouldn't be a problem with vaccination deliveries in time for the start of your flu campaign. Is that your understanding too?
That is our understanding too, and I would say every year there's always a risk of delaying stock being delivered, flu vaccines going out of stock, and obviously we do have to predict, and it's impossible to know how many we need to order, how many we need, how many people, especially this year with pharmacies being quite well established now. After doing the delivering the COVID vaccine, pharmacies are well established for delivering this service as well. And so we do have to give a rough guess of how many we think we're going to be vaccinating, and every year we always have the risk of they may be delayed. So it's a bit of a gamble when you set your flu clinic up and you've got to hope that your delivery arrives in time. But yes, my understanding is that there shouldn't be a delay this year.
Oh, good. At least that'll be something. Yeah. Lastly, how are you planning on using the MyGP Connect system that you've got in your practice for your flu season?
Well, we actually started it yesterday. And at the minute I've set up so we're sending out 200 SMS messages a day. We've got a couple of clinics set up ready. We're trying to target those who aren't necessarily in stage 1 for the booster. If that happens, we're having to kind of, we don't know if we're going to be delivering both vaccines at the same time, but we've decided to get us, hit the ground running with flus anyway. And so we've targeted those who are less likely to get the COVID booster, so at least they've had the flu. I've set up a lot of messages, 200 a day at the minute, to go out over the course of the week. And I would like to, I need a refresher on how patients can book their own appointments. I know they can do it on the app, I know. And at the minute, we haven't been doing that because we haven't been face-to-face. But the flu campaign is different. It has to be face-to-face. And at the minute, we're running it on slot type, so over 65 vaccine, under 65 vaccine. I'm not sure how that would work. So it's something we want to do and will do. I haven't done at the minute, but basically we use the SMS for everybody who is eligible and who has a mobile number, and it's absolute lifesaver, to be fair. It's a game changer.
Yeah, definitely. Brilliant. That's really good to hear. We do offer refresher training, the flu events, the planning. We are going to include the functionality that you're looking for so that patients can book those appointments directly from the invite, and hopefully that will reduce the incoming calls into the practice.
It's definitely something we would want to do. I think, like I say, I'm out of touch with it because we haven't been doing it. But I think if we'd been doing it for the last year, where they could book in to see a GP, we'd be very familiar with it. But it would be something that I think I would have to have a quick return on.
No problem. Well, thank you so much for your time today, Christine. You've given us a real insight to how things are in your practice and how you perceive things today. Thank you.
Thank you for having me.
Thank you, Christine. I'm sure you can all relate to the challenges that Christine mentioned and have hopefully learned some new or different ways of managing your flu programme this year. So we're now going to take a look at the solutions that MyGP provides. It would be wrong to suggest that digital technology can address all the challenges that GP practices face by itself. However, after supporting our vast primary care network of users and commissioners over the last 17 months, we feel we have developed an overall solution that addresses most of the urgent challenges. Today, we're going to focus on 3 features: MyGP Connect, MyGP app, and population health. With flu season on the horizon and COVID vaccines still taking place, MyGP provides you as a practice and your patients with some simple, easy to use functionality that not only reduces your admin burden, but also increases your patient uptake. The MyGP Connect platform also helps you reach those patients that don't engage with the practice. As Simajin mentioned earlier, results from our recent survey show that SMS is seen as the most preferred choice of communication by patients. Most practices on our call here today are already using the Connect platform to send bulk campaign messages as a line of communication with their patients. You'll be aware that this allows the coding of invitations directly into your clinical system. This functionality also captures and codes specific patient responses too, ensuring patients' medical records are fully coded and kept up to date, with the patient's intention of taking up their invite for their flu vaccine or not. With the added ability for patients to easily cancel appointments that they've received, whether it be a simple click on the MyGP notification or by replying cancel to the SMS message they've received, our built-in functionality allows the recycling of unwanted appointments and reduces those that would previously have just DNA'd their appointment. Practices that are on board with MyGP will be able to communicate with their patients, including appointment reminders and campaign messages free of charge, as these will be sent as data messages. Patients with the MyGP app will receive in-app information from their practice, and this can be enabled to provide them with the ability to book an appointment directly from a call recall invite that the practice has set up. This not only allows you to send mass communications to your patients from a single campaign message, it also reduces the needs for patients to then have to contact the practice to book a flu appointment, which will hopefully reduce the amount of incoming calls that you receive. By using this line of communication, you are ensuring that as a practice, you are in full control of which patients are invited and able to book into flu vaccine clinics, so that patients are seen by the correct healthcare professional with the relevant skills, and all appointments are booked into clinics with times that you have configured. Simajit is now going to talk about population health.
Thank you, Amanda. Now, population health allows centralized working at PCN, CCG, and ICS level. Some CCGs already have this in place, where they would manage the service and Hub would send messages to patients on behalf of practices. This ensures consistency with messages being sent, keeping the costing to a minimum, and messages are sent at an allocated time and not depend on the practice resources. There's also the availability to include chatbot interaction. This helps to alleviate patient concerns, myths in respect to the campaign that you are running, and also stops all the misinformation that we know is out there. Population Health are also now offering a flu vaccination web booking system like the COVID booking service last year. Now, this is completely managed by the Hub team. We set up an online flu clinic on behalf of the practices and send patients a message with a link on how to book into an available slot as provided by the practice. There's never been a better time to see how MyGP can help. I'm now going to pass you over to my colleague Dan, who will demo MyGP Connect and call and recall feature. For more information about the Population Hub or Population Health, please email hub@iplace.com. Thank you.
And thank you very much, Sim. Yes, hi there, I'm Daniel. I was the voice at the beginning, you may remember. Welcome to my little section here. I'm going to take you through the systems that are available to you already as practices, your MyGP Connect system, how to send a bulk message, and how to use the call recall function. So the first thing we need to do is log into our MyGP Connect system. So here's our login page we all know and love so well. So I'm going to go in here. Now, I should point out I'm using my demo environment today, so you may see things that look a little bit different from your own MyGP Connect system. Don't worry, it's just because we're in a demo environment here. Now, of course, any health campaign you would normally run would begin in your clinical system. You would run a search for the patients that you would like to message, and you then need to export that search onto either an Excel spreadsheet or a .csv file. And in true Blue Peter fashion, here is one I prepared earlier. Now, for our Vision and EMIS users, you would just need to make sure that your spreadsheet or CSV has a patient ID. For NHS numbers, that is used with our System 1 users. So I'm going to just work off ID numbers for today. I'm just going to ask the system to copy that. My example here is only a few patients. You can have up to 6,000 in one group, so you can do hundreds at a time. I'm just using a smaller example today. Once we've got our patients, we go to campaigns, we go to groups, and we're going to create a new group. We're not going to worry about the ones that are already there today. We're just going to create a new group. I'm going to give my group a name. In this case, it's going to be Flu Vax Invites 2021. You can be as specific as you like about this. It's patients we're messaging, so I'm leaving that there, and I click Add Recipients. Now, I can add patients individually, but I'm going to use this box at the bottom. Top tip for System 1 users, just make sure that says NHS numbers before pasting in the details. I'm using patient IDs, so I'm going to paste that in. I'm going to move them to the right-hand side. And my patients are now ready to be saved in this group. Now, if I did have any patients who weren't registered with a mobile, I could click excluded. And if I had any listed that were didn't have a mobile registered at the practice, I would be able to copy and paste their details somewhere safe, because I'm going to have to message them another way. Once I've done that, I would click included, my original list returns, and I click save. And there we go. Here is my group at the top here. Now, top tip on groups, do have a look at when it was created or last changed, because these groups are static. They will not change until you make a change to them. So if you create a group but don't get to use it straight away, then you may want to consider either editing and doing a new search, or indeed simply deleting the group and starting again to have the most up-to-date patient data in that group. Okay, so once we've created our group, we then need to create our template. So we go to campaigns on the left and we go to templates. Now, again, there's going to be a number of different templates here depending on your practice. You might have a few, you might have just one or two. Everyone by default is loaded up from our support team with a Flu invite template that you should feel free to edit and use. Further help and templates can be found on the help section of your system here. Do feel free to copy those, edit, change them as you would need to, as you know your patients best and the best way to talk to them. Now, we've got a few different Flu variations of templates here, including an over 65s one, for example. I'm just going to create a new one today for you so you can see how that would work. So we would go to create template. We need to give our template a subject. Now, you can file it away under an existing header. For best practice, we suggest to create a new subject for every template that you do. And I'm going to give it the same name as my group. Now, I'm going to use an example template today. This is available on our help page on the Connect system, as I mentioned. So don't worry about trying to write any of this down. It is available for you. And there we go. There's our template. Now, it's under 160 characters, so it's going to go as one message and use just one credit to send. It's got the surgery name at the front to catch the patient attention. And it's also got here a mail merge term. This is going to go to the group that you connect it to and fill in the first name of the patient. So for those slightly trickier to reach groups like our teenage cohorts, where perhaps they're still registered under a parent or guardian's mobile, you can put the first name mail merge in here so that it populates the name of the person in the group, the person you want to invite. So if it does go to a parent or guardian, it's clear who the flu vaccination is actually for. You would then put in your telephone number for your patients to maybe call to book an appointment if you're doing it that way around. And importantly, as we saw in the interview earlier, we have the ability to help a patient decline, to refuse the vaccination, so that you don't necessarily have to chase them if you simply can't get hold of them, if they're not actually wanting it at all. Save you the time on that and actually get to the people that want it. Now, at the moment, that word decline there, that's just a piece of text. If a patient texts that right now, nothing would happen. We need to assign a clinical code to that text. So that's what I'm going to do next. So I'm just going to save my template. It files away alphabetically, so it runs down here. And now let's go and get that trigger word sorted. So we're going to go to campaigns on the left, go to trigger words. And we can see some examples. Again, this may be different from yourselves. On our demo screen, we've got a few different examples here. Now, to create my trigger word, I would go to add new. I need to give the campaign a name, so I'm just going to call it flu. My trigger word was the word decline. I'm putting this in capital letters here. You'll have noticed that on the template and here. It doesn't matter if the patient texts upper or lowercase. It's just so it's clear on the system what we would like them to do. Now I'm going to enter an example clinical code. Please do check the codes you want to use in your own clinical system. I'm using an older clinical code here. We are fully compatible with SNOMED if you are using SNOMED. Just let our support team know that's the codes you would like to use. As you can see, when I put the code in, it's guessing at the one that I want to use. So I will click on that and it will then populate the term below for me. I then need to give an end date, and with your campaigns, always give an end date of at least a couple of weeks. I'm going to do a few months, actually right the way through to the end of flu season next year. The reason for that is you're going to get your responses quite quickly. Most of them will come in the first 2 to 3 days, but you will get late responders as well. So you want to be able to catch those who respond 2 or 3 weeks later with the decline word. Also, if I put it that far in advance, I know that that's set for me for all the flu campaigns that I'm about to send out. I don't have to come back and check. I know I've set this through to the end of flu season next year. I'm going to save that one, and that's gone on my screen here. The green dot lets me know that it's active, so the system is paying attention and looking for that word, and will send back the clinical code to my patient records if the patient texts back that word. Fantastic. Well, we have our group, our template, and our trigger word. So we've just got to put them together to send them out. If we go to campaigns and go to new message at the top, we will be able to select our recipients. Groups will be in the bottom left, so we will find our group, move it to the right, and then click next to move on. Here we need to create our message. We could literally start typing on the right hand side. However, we've done the hard work, so we go find our template. We can see its subject, select the message you want to use, move it to the right, click next, and then schedule when you'd like the message to go. So for example, if you do want to queue it up to go a bit later, maybe you've got a campaign already out there, you want it to go a bit later, you would pick a date that you want it to go on, and you could choose a particular time as well. Time here is in 24-hour clock, so do be careful and not putting 0102, for example. You also get to add a clinical code. Now, adding a clinical code here will add a code to the message you're sending itself. So you can code back that you have invited your patients for a flu jab. Again, I'm just going to use an example code here. Always double check the codes you want to use in your own clinical system. We select it, and we could even put in free text at the bottom of the message as well. That goes back with your code to your patient records. We then need to check the reply email because the system would like to keep you apprised of any text responses from your patients, and it will do that by turning the response into an email for you to see. Now, the patient does not see this, it's all in the background. To control where this goes, click on change, and if you don't want it to be your own email, click on custom email list. The system always defaults to the person using the system. Click on custom email list, pop in an email address that you would like to use, could be a generic one for the practice. Click the little plus button, and once it's in the box below, click save. Always do this on every campaign, as the system will never assume it's the same message, the email that's to be used on each campaign. Once we're ready, we click confirm to send, and we can double check what we've done. So we've got the message at the top here. We can see how many characters, how many people it's going to. My credit balance here shows a minus figure. Now that could be fine depending on how you're funded by your CCG, or if you have credits preloaded. If you're not sure, please contact your support team, sorry, here at iPlato, or your account manager. The details of when it's to be sent will be here. Your default clinical code to say a message has been sent will be here, and the custom one you entered will be recorded along with the email. Tick the box here to get a copy of this through to that generic email address you enter. Once you're ready, click save. Message has been sent, and you'd be able to find these in the messages tab. So anything queued up is an outbox. Once it's gone, it's in the sent box, of course. Your patient replies will be visible in the messages tab. Now, if you want to use call recall, that was the function that Amanda was talking about by inviting people to book into a specific slot. That's also under the campaigns menu, and it would be under call recall. Now, again, don't worry if you don't see anything here. I'm going to click add new. And again, we get to add our patient details. So just for a change, let's go back to our list, and we'll use the NHS number as though we are a System 1 practice. Make sure it's registering NHS number, paste them in, move them to the right. And this button here will allow you to export any patients who are excluded from that, such as those that don't have mobiles. You then create your message, and this time you get to send to. Now the system will decide which message goes to who, because our system will know whether or not your patient has downloaded the MyGP app. Again, I'm going to put some examples in that are available on your help page on your Connect system. So you can let your patient know that if they have the app, they can just go in and book. If they don't, they can download the MyGP app to get the information. The clever bit is the next bit, where you assign a slot type. So here you will find a mirror of the slots available on your clinical system. Now, this will obviously vary from practice to practice, but I've got an example one of flu vaccination. I'm even going to call it the flu jab as well. So it will appear as flu jab to my patients. And then I can say when I would like this to be available. So my clinic's going to run in September, and I want that to run from a week. So that date range there, that's when this button will appear in the MyGP app for my patients. I then just choose when I want the message to go, and we want the message to go and let them book in straight away. So I'm going to have the button appear and the message to be sent on the same day. And we even get to add a clinical code just like we do with our campaign. So we can actually go in, pop in the code, and have that code back as well for us. When I then send this, it will get the confirmation summary. I can send this to my patients, and I can have multiple call recall campaigns going on at the same time. This means that I can send my patients a message through call recall. They will get a notification like this. And as a short demo for you, you can actually see how it would look from the patient's perspective on the phone. So they would go into their phone. In this case, it's ID'd me. We can already see the booking. We can see that button there letting them know that they are able to book in. In this case, it's a COVID vaccination appointment on the example. We've gone in here, we can see the message that's been sent. And if I skip forward for us, we can see that the patient goes back and can find the appointment. So if you've made appointments available in general for your MyGP users, their button will appear here. If you've messaged someone on call recall, only they see the button you've done there. Sorry about that. My slides decided to go a little bit funky there all of a sudden, but we are indeed at the Q&A section of the session. So thank you everybody for staying with us. I know you'll have been asking questions as we go through. I'm actually going to hand over to my colleague Thor, who's been manning the Q&A chat, and will answer a few of your questions now. So I'm going to hand over to Thor.
Hello, everyone. Thanks for your questions in the Q&A section. I'm trying my best to answer everyone sort of in due time. Also, we've overrun the ending time of the session as well by 2 minutes. So just to let you know, if you've gotten the information that you want and you're not obliged to stay on to the session, it's just if you have a burning question, throw them over to me. We'll have about 5 minutes now where I can answer them. So just to recap a few things that have been covered. So let me just skim through here. So just a quick one. One of you was having audio issues and asked, will there be a recording available of this event? Yes, we'll be sending out a follow-up email. So you'll be able to see the event in full. We'll just post it on YouTube and you'll get a full link for that. So there's an issue with campaign messages, the default email address. Okay, Joanne, so I answered in terms of changing the campaign messaging default email address. You can do that, but you mentioned with call recall, that was the issue. So with call recall, patients are receiving that as either an invitation on the MyGP app or as a text message. So they won't be receiving emails as far as I'm concerned. There is a general section where you can allocate all patient replies from your MyGP Connect system to one specific one. So that's all replies. So this might be the workaround if I'm trying to understand your inquiry there. So you could set that up. I can follow up on that inquiry in an email. Let's just see if we're getting more questions here. So for IFRAN Practice Manager, Pack Health Center, you mentioned you had a problem sending a message earlier. So sorry to hear that. That's not a problem. Please contact our support team at help@iplato.com. or I'll send over the contact details, ring them, and they can see what's going on there and possibly probably solve that issue for you quite quickly. So you've also asked for us to recap call recall functionality. Unfortunately, we don't have time to recap that part of our event. However, as I mentioned, there'll be a recording, and also in the chat, I've posted a link directly to our help section on call recall. You have video tutorials there and step-by-step guides that will show you that. So just have a look in our chat section. I've put in a direct link. In call recall campaigns, do the slot types need to be enabled for online booking in EMIS? No, because it's done via MyGP Connect, so it picks it up as a slot in on its own. So it wouldn't need to be linked to EMIS in order to pick that up. Inquiry from Tammy. We tried to use the call recall for COVID vaccinations in patients who did not receive the SMS were able to book online. Any idea why that might be? Great inquiry. So I might just look into that, and let's follow up on that one in an email so I can just get more details on specifically what the message was sent out, and we can look at what any issues might be. Okay. All right, so I do see we've overrun about 36 minutes. I have 2 more questions coming in. But I might say let's wrap this up, and we will follow up on any additional questions in email answers. Okay, so I'm going to hand it back over to Dan.
Thank you very much, Thor. Yes, thank you very much indeed for your questions as well. We really appreciate it, and you've answered some really good ones there. So if we weren't able to cover it today, as my colleague Thor has mentioned, he'll take some of those offline and follow up with you separately. So thank you very much for those questions so far. I will just very quickly mention one more, which just came in from Jack there at the end about is there a way to change it from read code to SNOMED codes? If you need to change your system to SNOMED codes, please contact our support team. They can be found at help@iplato.com. I thought that might be just worth mentioning there. Finally today, I know you've all been waiting for it. There is a prize draw that Sim mentioned at the beginning. Now I was hoping to do this at the end of the session here and live for you, but unfortunately I can't see all the attendees, so I can't pick someone at random. So what's going to happen is we are going to from the list of attendees, the full list, pick someone at random, and we will email them after the event. Once we've done that, we will send a wrap-up email around to everybody who attended with useful links and information linking to recordings that we've done and also the session, so that you can see those. So you can see also who actually won as well, because I know you're all keen to know. Otherwise, thank you very much indeed for your time. We really do appreciate it. We know how important your time is. We thank you for joining our session. We hope you found it useful. And until the next time we meet, thank you very much indeed. And goodbye for now.
Everyone.